getting medications to line up and be all in the right order can be really, really tricky and difficult. And for you, really frustrating. So what we've done is we've used SystmConnect, which is our online information portal, to try and make it easy for you as our patients to get all of your medications sorted. Okay, so we're going to jump over to SystmConnect and I'll show you what I mean. So if you scroll down, go on SystmConnect here, okay, and then if you want to, you can log in here, okay, but if you don't have System Online and you don't know your NHS login, really doesn't matter, okay. So go on to medication requests, and here are some really useful other options, okay. So you can ask for a one-off medication again, continue now, and then I agree, this is not a type of query. And basically, if you've been given a medication before, often like certain types of really strong painkillers is a classic example that we don't want them on your repeat medications, but you may need them again. So here, I want to request a medication that I have been prescribed before, yes, and then put as much information. So let's say codeine, 30 milligrams, next. And then all we're doing here is just putting all of your information down, okay? If you're doing this on someone else's behalf, click someone else, okay? Put your information down at the top bit and then put the patient's information down, so who you put in this request on for at the bottom bit. And that is it, simple. Once it's done, hit submit request. So let's go back to the questionnaires because I'll show you some other options as well from a pharmacy point of view, which is really, really useful. So we've got medication request. Medication query is brilliant, okay? So what I would say is my medications don't line up. So you might have because you've had new medications added or they've just not got out of sync, they don't line up. With regards to this, what we can do is this goes to our expert pharmacy team, and between them, they'll sort it out, basically. Are you having to order your repeat medications more than once a month? Yes. Okay, would you prefer all your medications to be ordered at the same time? Yes. Which medications are running out at a different time? Okay. And then, so what I want you to do with this is to, put as much detail down. So, for example, if you've got atorvastatin at home, put that I've got, as of this date, I've only got 10 left. Okay. We might have Ramipril, and as at this date, I've only got 14 left. So it's very, very clear when you're going to run out. And then what the pharmacy will do is they'll give you a top up or sort of an alignment prescription, which would be some odd dosing, just to sort of just to try and tie everything together. So in that box, put as much detail as you can do about what you've got in your cupboard, and when they're going to run out. Likewise, just so we tidy up your repeat prescriptions, are there any medications you're no longer taking that you like removing off your repeat list? Please, please, please keep us updated. I appreciate there are sometimes we miss out things or they're not 100%, but if you give us that information, we can make sure your medical record is as accurate as possible. Okay, so that's the really key ones. Again, we're going to go back on SystmConnect, medication query. If your pharmacist is struggling, okay, point them here. Okay, that is the easiest way to get in contact with us and get in contact with our team. Okay, and likewise, medication query as well is a really, really useful one. Checking that it's not of it, and then it's sort of like if you've got a problem or some question about your medication that you're not quite sure, what happens is all of this goes to our pharmacy team. They'll answer it and give you the best advice possible. Okay, not slating doctors, but sometimes we're not the best when it comes to medications. Okay, so Dr. Dave Harmarsh, go check it out online. If you're not savvy or whoever needs to access this is not sufficient on the website, you can still phone and get this through, but you can get someone else to do it as well. So you may have someone in your life who is better at this, and so they can help out. Hope that's useful.